The specific competencies that KOLB is associated with and aligned with really is under competency 1 and 2. There are 65 questions that are mapped to the exam. So 50% of the questions are going to be aligned with competency 1 and 2. Okay, so 65 questions overall. So this is why we spend so much time focusing on KOLB and all the learning theories, because competency 1 is my ability to be an effective educator in the classroom, to facilitate and to coach students through these learning phases. And we get stuck. All of us as adult learners, we can easily get stuck in the various phases of KOLB. And our job, our responsibility really is to help students move through all 4 of these phases. All right, so let's take a look at this thought-provoking question, and you all can hold on to your responses until we get to the end. So we have a nursing program that is being evaluated for its effectiveness in fostering critical thinking and clinical decision-making among students. The evaluator suggests incorporating KOLB's learning cycle into the curriculum. Which combination of activities best represents the full cycle of KOLB's learning theory? So 2 steps you want to follow for every question on the CNE exam. Number 1, what is this question really asking me? Okay, oftentimes in the STEM, we may have a distractor. And then second question you want to ask yourself is, what is it that I know for sure? So you should have scratch paper when you go take your exam. So go ahead, I would suggest, just like we did today, draw your pie, divide your pie into 4 sections, and then write whatever notes that are going to help you trigger a memory that will allow you to choose the best answer. And of course, you want to be mindful of your time, because you do have 3 hours to take the exam. What you're going to notice is we're unfolding the content on our presentation slide. This is a strategy I encourage you all to use as well. There's actually a coach that I work with, and he talks about our ability not to allow our audience to read ahead. Because what happens is, instead of focusing on what I'm saying, you all are looking at the content on the screen. Our students are no different. So I would encourage you, even with our objectives, you notice that I didn't have both objectives on the screen at once, right? I'm unfolding the content as we talk through each of these points. So I encourage you to try using this strategy as well. So A is lecture on clinical decision-making, clinical practice activity, followed by a written exam and group discussions. B, hands-on clinical practice, followed by reflective journaling, group discussions, and applying new strategies in practice. Or C, case study analysis, followed by group discussion, quiz questions, and a lecture on related clinical concepts. All right, so I'll give you a minute to kind of process what those 3 options are, and then just write down on your sheet of paper what you think the best answer, the correct answer is based on the question. All right, very good. Hopefully you all have had enough time to kind of write down what you think is going to be the best option and the correct answer. This is the example that we pulled from the literature that is published. I know that they misspelled accommodating, but we've tried a lot of different versions to really help colleagues kind of solidify this model so that it makes sense for them. And this one has been the winner so far for many colleagues. That really does help them. So remember that you're only using our 2 resources to help you close your knowledge gaps. And that's going to be Dr. Caputi, that's the 2nd edition, and Billings and Halstead, the 6th edition. That's the one that was used to develop the content for the exam in 2024. And then your study workbook. So if you have the study workbook, this is going to be on page 27. We have a model with some content to help you close your knowledge gaps in this area as well. And what I would encourage you to do, just like we started with our pre-assessment, doing a little bit of an evaluation before we reviewed the content, I encourage you to use this strategy in your classroom as well. We want you to be able to integrate these teaching strategies so that whenever you're moving forward on your journey, hopefully it will decrease anxiety, because it's going to increase your confidence in your ability to role model these behaviors that we're talking about. And hopefully that will trigger a memory when you get to the exam. Our journey together is really all centered around focus. This is why we're very strategic in the content that we develop for our monthly boot camp. We want to be able to clarify any muddy points that you all have as part of the summer series aligning with KOLB and with curriculum. So the three components we're focusing on today are engaging. So how do we do that? Well, it's through, first of all, understanding each of the phases associated with KOLB experiential learning cycle and making sure we have developed engaging strategies and activities that will fully empower our strategies that we're using. And what that means is we want to map our teaching strategies to align with the learning styles. Okay, so as an example, going back to the assimilator that I am, I want to have those textbooks in front of me. I want to have the literature articles whenever I'm attending a workshop. I attended one yesterday and I'll attend another one this afternoon, but I want to know where is it that they're pulling this content from? And oftentimes, because it depends on the format, it's not an academic presentation necessarily. And so I'm always asking that question, where did you get that statistic from? Or can you cite that source again? Because it's important for me as an assimilator to go back and look at the evidence, right? I'm a very logical thinker. And so I want to be able, first of all, to validate that content. And second of all, before I repeat it, I want to make sure it's accurate information. So think about how that plays out in the classroom with our students. We essentially are empowering our students with knowledge so they can make safe patient care decisions, right? We're enhancing the outcomes by telling the student that, giving them feedback, of course. First of all, when we talk about engagement, we're engaging in that hands-on experience, that concrete experience. And then we're empowering them by giving them the reference, by talking through any content that they have a muddy point about, or it could be that they have not followed the 5 steps to inserting a Foley or sterile technique, right? So we want to empower them by giving them feedback, by helping them comprehend a concept and ultimately apply it in analyzing. And then we're enhancing the outcomes. Not only does it lead to safer patient care, but also students will perform better in the classroom. And that is ultimately our goal, right? It's both. We want students to do well on NCLEX, but we also want to bridge that theory to practice gap that Patricia Benner talks about. That starts in the classroom. We should engage in those unfolding case studies. We should engage in role play to help students in the classroom kind of connect the dots. And we want to leverage their clinical experiences as well, right? We know that there's value for pedagogy where we are that content expert, and there's also value in andragogy where we're leveraging students' clinical experiences that they have in order for them to find salience or to find purpose to align with their why. Why is it that we want them to follow this sequence for sterile technique? Well, we know that it's going to lead to safer patient care and less adverse events.